What's broken-ish? How about deaths of despair have more than doubled in the last 20 years? Drug overdose, alcohol poisoning, death by suicide. I've yet to really experience, from a community perspective, somebody saying, yeah, we feel really good about the direction that we're moving as it relates to mental health and substance abuse. I think for me, what had to change was realizing that every single day I have a choice. And that choice is, do I do the next indicated thing which can create impact in somebody's life today? I feel like the community is fired up for Ava Health. And because I think the community believes in this vision, and they believe in the grit and determination and resilience and working together and collaborating, that it feels to me like there's hope. What's broken-ish? How about deaths of despair have more than doubled in the last 20 years? Drug overdose, alcohol poisoning, death by suicide. There's all these communities that are in desperate need of mental health and substance abuse treatment. If you go into a lot of these communities and ask whether or not there's any hope, there's any forward momentum, there's progress, there's excitement, I've yet to really experience, from a community perspective, somebody saying, yeah, we feel really good about the direction that we're moving as it relates to mental health and substance abuse.
Damn. That's disheartening to hear. Seems like a overwhelming problem. Like, I don't even...
Well, overwhelming, I think, depends on how you look at it, right? That for some of us, and I know you're this way as well, we look at these things and say, like, there has to be an answer, right? There has to be a solution. Now, some of that for me is definitely tied up in ego, right?
Right. Yeah.
I have to be able to kind of check myself and say, right, like, these systems are so big and they are broken, at least broken-ish in so many different ways. And yet, am I responsible to fix those systems? Like, that becomes a bigger question.
Yeah.
A bit of an existential question.
Right.
Right? Is one single human being responsible? Which, of course, the answer is no. But it definitely impacts my sleep.
Yeah, and I think that there's a heaviness, a weight that's palpable.
Well, for sure. I mean, I know you feel it when you're out in the community and talking to guys on the street and, right, all that. And so it's like we both come from having worked in this system for so long and seeing the insurance denials, the inability to get a good insurance policy to access good care, the programs that only take really good policies, that only take private pay, that, you know, aren't as oriented towards, like, serving the greater demand, which is people that don't have money and don't have great insurance and, you know, generally, like, just the limited access to care, right?
Yeah, and I would say even my experience working in this industry for as long as I have, I've seen some amazing clinicians, innovators, amazing minds, problem solvers, world changers. I've seen them be crushed by that weight. And I've seen a lot of them, like, leave the industry entirely. Like, can't fix it. I don't know what to do. And, like...
Well, and that's where it becomes like, it becomes this kind of existential question, right? Which is, it's so easy for me in many ways to look at these, like, massive world problems, right?
Yeah.
And think, like, there has to be something done, right? And then there's a really crushing weight when you think about, well, am I going to somehow be able to fight the insurance companies or big pharma or the funding sources or these things? And I think for me, what had to change was realizing that every single day I have a choice. And that choice is, do I do the next indicated thing which can create impact in somebody's life today, whether that's one person or 10 people, without having to focus on the 100,000 people this year that may overdose, or the men that are so isolated and lonely, and how to create community and connection for, you know, men across the world that are struggling with that, versus can you create something that does impact somebody today.
Have you always felt that way?
I think the people that ultimately like create change in the world are the people that think big enough and have the ego strength in many ways to think about the big problems and how could you change them.
Yeah.
I think the shift for me that's been monumental is instead of looking at the system and how broken it is and thinking about the complexity of how you would fix a broken healthcare system, is to say, I have a lot of knowledge of how this works. I have a lot of knowledge on the intricacies and complexities. What if we shifted the focus instead of fighting against, right, this behemoth of a system that you'll never be able to push against to create momentum that way, is to come back and say, what if you can create solution within the broken system? What if the knowledge and the expertise and the experience that you have within the broken system, you could then create solutions within that?
Right.
So that idea of like, how could you create healing from within?
Yeah.
Instead of pushing against. So how do you become an ally to the broken system instead of an adversary? So I would say for 15 years in the industry, I was Mr. Adversary.
For sure.
You know, everything's broken and all these unethical things and all these people. And if you shift the focus, if I shift the focus and go, how many amazing people are there? How many people are looking to create change? How many people can get aligned to a bigger vision? How many people want to show up and create change and impact on a daily basis? Right. And that's just like that's a small piece of it.
Right.
But what if you start to shift the perspective out of fighting against instead of partnering with, working within, becoming an ally and a friend?
It's such a new concept for me.
Me too.
Personally. I mean, you said it, man. 15 years of fighting the system. I was doing the same. And I describe it to people like, if you've ever had a dream where you're like fighting someone, but your arms, like you're punching, but your arms won't move. They feel like needles, you know? That's what it seemed like right now for years. And it just left me tired.
That's the worst dream, by the way, to ever have.
For sure.
When you got to protect yourself or protect your family, but you can't really fight.
Yeah. That was me fighting behavioral healthcare system.
Right.
Yeah. Nothing really was accomplished.
But that's what leads to the burnout that you were describing.
For sure.
Right. Because then you feel like all this weight. Right.
Yeah.
And how can you continue to carry burden in that way? Right. That's so heavy. And I wrote about that like a few weeks ago, right? Like how do you hold both, like this idea of hope and heartbreak? Heartbreak being, we know the system and like how it is not built to serve. It is not built to create access. It's not built to provide high quality care and good cultures and take care of employees, right? Like that's not really built. So how do you hold kind of that heartbreak and at the same time hold hope? For me, it comes back to like, that's what true, like, let's call it emotional intelligence would be.
Yeah.
Is that ability to hold the kind of contrasting emotions at the same time without letting one overwhelm, right? Because if I get too hopeful, then I'm disconnected from the reality of it.
Right.
And if I get too much into the heartbreak of it, then it becomes the massive gorilla on your back that just starts to feel crushing.
Especially in an industry where like there's so many varying levels of heartbreak. I mean, the system itself, but then the clients that we serve and the places that we go and the stories that we hear. Yeah, it could be very heartbreaking, but you balance it with that sense of hope and purpose. What did I say? Passion?
I think it's a bit of all of it, right? That purpose, I think like I've had to fall in love with purpose. We tried to really walk away from the industry because I lived too much in the heartbreak element.
I know.
And when you become so overwhelmed that it impacts your sleep and your family and, you know, you're just spinning your wheels and all that, right? You want to walk away. For me, it's, I have to come back to like deep inner knowing that this was the world I'm supposed to be in. Like I was put on this earth to be able to serve.
Yeah.
And especially serve people that understand the depths and the darkness of mental health challenges and addiction, and being able to give to that. So I think that the purpose leads to so much, but it's that constant journey of being able to carry both at the exact same time. How do we carry the weight of the system? How do we look at that, but not become overwhelmed by it? And then take a really curious approach to bringing together creative, intelligent, smart minds around, are there opportunities to create solutions and change within a very broken system?
Yeah, I guess the interesting question for me when thinking about this is, you know, our experience is pretty similar. Feeling discouraged, a little burnt. Maybe this isn't the career for me. Let me try something different. And then rediscovering that sense of purpose. Like, how does one who's fought the system to no avail come to this new idea of, okay, maybe not fight the system, maybe work within the system. Maybe we can do something within this confine. Don't have to necessarily like reinvent the wheel, but let's find a way to operate within it.
The first thing for me was curiosity. And we talk a lot about the idea of like sparks of possibility.
Yeah.
It's hard to see sparks or to remain curious if I feel like I know the answers, which was definitely part of the like struggles that I went through for the first decade of my career plus, was feeling like I knew better than. And what that does is then cut off the ability to explore, to ask questions, to learn, to have a bit more of that beginner's mind and say, maybe I don't have the answers. Maybe I'm not the expert. Like, how do I, so for me, it was a mindset. It was a mind shift into curiosity. And I think what happens when we do that is then those things that we may not have heard before or seen before, they start coming into your life.
Yeah.
So for me, I watched a couple friends of mine in Virginia open up a program that still serves homeless women on Medicaid, and to do it in a way that is on par with private pay care.
Something that seemed impossible.
Correct. And then it was like, oh, you know, prior to that, I would have told anybody, you cannot do that on Medicaid.
Right.
But I didn't have a lot of experience. It was just this preconceived idea, and talking to people and being a part of the private pay kind of private healthcare industry where people would just say, oh, Medicaid, like you can't work with Medicaid.
Can't do that work. Yeah.
You know, you won't make any money and you just can't really help people. You have to overwork your staff, right? All of these things. And that just became a belief without actually asking why.
Yeah.
So it's like that shift a bit, right, opens the door. And then you continue to have conversations with different people who think differently, see the world differently, who start to be able to say, why isn't that possible? Like, have we actually taken the action? Have we actually looked at the numbers? Have we looked at what we could do? Have we looked at how you could create efficiencies and use technology and do all these things to potentially serve more people? The answer for me was no. Like, those weren't conversations I was in. But I think once the mindset shifted from I'm the expert and I know and I have the answer to I'm not the expert, I don't know if I have the answer. I'm pretty sure actually I don't have the answer because these numbers, deaths of despair, continue to go in the wrong direction.
Right.
Let me be curious. Let me ask questions.
Yeah.
Let me say yes to a meeting I wouldn't have said yes to before. Let me ask what someone's experience is. I think it requires us to shift a mindset.
Yeah.
To start to become open. Like, let me actually talk to someone that works at Medicaid in whatever state you're in. Let me talk to them about reimbursements. Let me talk to them about what they're seeing, what they'd like to see, what would be helpful to them. Right? Those are just things that I never would have considered 5 years ago.
What a unique ability to like disregard preconceived beliefs. That's a hard thing to do.
It had to come from a place of pain and suffering as usual for me, which is, it's a part of like the unfortunate reality of who I am as a human being is a lot of times I have to get smacked in the face by the world in some way to help me shift the belief or to become open-minded. And so there's obviously much more of a journey that got to there.
Yeah.
But that ability to take the experience of, again, a particular system, a particular work environment, whatever it is, and to try and extract the lessons, extract the wisdom, to develop the insight into what worked, what didn't, what needs to happen, right? To me, that's growth, right? So just as a human being, and I could reflect that on my whole life, right? What's working in relationship, what's not working in relationship, what's working with my daughter, what's not working, right? Like having that mindset of continuing to want to grow and to learn. But yeah, I mean, my journey was absolutely one that was filled with pain and suffering that kind of led to those moments of becoming open. And then it began to kind of attract in different people and different sparks in the world to then open my eyes to, is there a different way? And not just that, but it was also the genuine desire to sit with other people and say what feels really important to you in this world. And what I heard were things like, you know, healthcare equity, like everybody being able to receive the same level of services, no matter where you come from or how much money you have. And that then started to create this fire and this passion of there are so many people that are in need. There has to be some answer.
Yeah.
Even though we may not find that answer for the next 10 years, we're going to take a damn swing. We're going to step up to the plate and get in the game. Yeah. And we're going to take a swing.
Yeah.
And maybe we'll hit a single.
Yeah.
Which will be fine.
I guess.
Maybe we'll hit a home run.
There you are.
Right.
Yeah.
And like, that's for me, what continues to wake me up every day is saying like, look, we're going to be in the game.
Yeah.
Like we may not have figured it out.
Cleats are on.
We're off the bench.
We are off the bench.
Yeah.
Yeah.
And so, you know, as it relates to like where we are now, I mean, I remember the first phone call that sparked this idea, which was over 2 years ago when David came to me and he tried to explain to me this opportunity in Colorado. People were being put in jail instead of accessing mental health care. The state had been sued, all this stuff. And I didn't even understand the conversation. Back when, I probably would have been like, hey, like, I don't even know what David just said to me.
Right.
I'm like, I got other things to do.
I'm out.
But I took a phone call.
Yeah.
Right. And that phone call led to another phone call and another meeting and asking about what are these communities really experiencing, which led us out here to Western Colorado, sitting in city council meetings and meeting with county commissioners and meeting with the fire department and the sheriff's departments and right, like just all these people on the front lines and saying like, what is this community experiencing? Right. Instead of coming at it with like, oh, like Chris is the brilliant entrepreneur. Like he knows what this community needs.
Right.
Why not listen? So it was like taking that same mindset shift of curiosity and saying, let's ask as many questions as we possibly can. That then led to, okay, this community is experiencing these significant barriers, right? There's a super fractured system, meaning there are services that exist, but they're not connected. They're not talking to one another.
There's a real collaboration.
Yeah. I mean, yeah, just one of the examples I could never get over was the idea that when I was talking to the DA originally, he was saying that somebody they had referred into the community for care had 7 different providers. So they had someone for housing. They had a different one for case management. They had a different one for med management. They had a different one for therapy. They had a different one for whatever it was, right?
Yeah.
And he was saying, but like, they don't even talk to one another. right? Because again, they're burdened, they're overwhelmed,
Yeah.
lack of funding, right? All of this stuff. And so it's like you start to hear about these fractured systems where there's a lot of amazing people. It's such an important note. It's like there are so many incredible people that like have the passion, the heart, the fire to show up and to serve. And yet they're limited by the system.
When we say broken-ish, we're not necessarily and usually not talking about people, right? Especially when it comes to behavioral health. There's a lot of amazing people who are trying to do amazing things, and a lot are doing amazing things. That's not what's broken.
No. And so it's in addition to like fractured care, it's lack of transportation. It's how does somebody get from one appointment to the next? How do they get from detox to residential? Or it's lack of communication. People don't talk to one another. It's overburdened and overwhelmed staff because again, the funding stream only allows for so much. It's right. So it's just
Gathering data.
Yeah, the process of really trying to understand a community in particular and then being able to create solution within that.
Yeah.
And for us, what it came down to was not only that we had to build a full continuum of care, one of the reasons to have to do that is so that somebody can have a single point of entry. Right. You can call and then like all the services exist for the most part, right? Yeah. We still have to collaborate and work with community partners. Correct. We don't do everything. But one point of entry for someone with mental health or substance use. But also because the way that the system is set up, different levels of care make different amounts of money. So if we just tried to do like partial hospitalization, there's no high intensity outpatient services in Mesa County. So we will be the first.
Yeah.
That level of care makes no money.
Right.
So one of the reasons it can't be done as its own individual thing is because it doesn't make any money.
Yeah, it's not sustainable.
So when you broaden it out and when we add all the different services, we can cover that service because we'll make more providing intensive outpatient.
Right.
We'll make a little bit more over here, right? Residential treatment, for example, doesn't make a lot of money.
Yeah.
So if you're going to do residential treatment without these other services, it's really hard to sustain, to pay people well, to keep it full, right? All these things. So you make more at detox, which helps offset the loss here, which then you lose even more at high intensity outpatient, which then you make a little bit more here. So for us, we start to look at like one of the only ways to do this is to sustain it is you have to have all the services because it's going to make the overall finances sustainable long term.
Well, let me backtrack a second. So you come out Western Colorado, start asking questions to people in the community. You start getting all this information, all of this insight. That still must seem like an overwhelming, daunting task, especially on your own. Like, how do you get to that point to then being like, okay, we got to do a full continuum of care because this covers this and over here. Like, what do you think? I feel like I'm missing something.
Well, you have to bring bright minds along, right? So for me, it's very easy to live in the clouds and to have these visions of impact and what we can do and how we can create change. And then you actually need people that understand how you're going to operationalize that vision and then how the numbers are going to work, right? And so that's how David Ein and I came together and were able to look at the creation of this. And then you need to be able to bring people along that believe and are lit up with the same fire and passion for that vision, which is how do you create high quality behavioral healthcare access, but do it for the masses instead of the few. And so that's what then takes all of these people, right? So you talk about like gathering sparks.
Yeah.
There's so many amazing people that are working in environments where maybe that aren't conducive to them being able to serve in the way that they want, or again, they're being overworked and underpaid and undervalued. And then you give someone the opportunity to say, look, do you want to join this? Right? Like this is where we want to go. And this is what we see, right? In total alignment and connection with the community. Yeah. Right. So we're not doing anything that the community didn't ask for.
Right.
There's not a single thing that we're doing. People go, yeah,
Yeah.
Like this is what I've been waiting for.
Why not? Yeah. Why
But
would?
then we start to gather the sparks, right? And then, then there's this North Star of, can we do this? And the answer is, I think you need people that are crazy enough to believe that you can, right? So people that get to listen to me and you talk about like this big vision, right? And doing this, right, in Western Colorado and going, yeah, we can do that.
Yeah.
And not going, oh, like, I don't know how we're going to do that. And I don't know this. So it's interesting because we start at this idea of the behemoth of a system and how crushing it is, to then moving into a place of curiosity and questions and aligning with a community and embedding in a community and really understanding the problem to then be able to bring together a solution that meets that, and then gathering the people that are necessary to actually bring that to life.
Yeah.
And then that's where like the alignment and the fire comes from now every day, which is no longer feeling this crushing burden of this industry, and yet feeling like free, feeling even amongst the chaos of the magnitude of this startup and how much there truly is to do, how much regulatory complexity there is, and how challenging the state is to work with, and all of these other things, to saying like, as long as we stay aligned to this vision and we continue to gather the sparks of people in this community that believe in that, whether they work here, whether they are just supporters, whether it's stakeholders, like that's what continues to wake me up every single day, is I still don't know. We are at the plate and we are going to take a home run swing.
Yep.
And yet I still don't know.
No idea.
Right? Like these are, again, new ideas and new concepts, right? Like private pay treatment for folks on Medicaid, right? Like that in and of itself is a unique concept, right? And we are bringing back in so many ways the idea of how can we create like community, which these aren't things that are paid for. Medicaid and insurance companies, they don't pay for building communities.
No.
So how do we figure out how to do a lifetime membership community that's open to the public? How do we do these things, right? Like we're continuing to challenge the norms that exist, but doing it in an allied manner with the people, and continuing to align with people that say, yeah, it's a really broken-ish system, but boy, hopefully what we can now see is hope.
Yeah.
And so it's like where we started was how many times we've walked into a community and you could just ask a group of parents at a school or a group, and then you say like, do you feel hopeful about where your community is moving in terms of addressing deaths of despair and addiction? And there's not a lot of people that would feel very inspired.
No.
And yet what I can say is, even though we haven't even opened our doors yet, that I feel like the community is fired up.
It's happening.
For Ava Health.
It's happening.
And because I think the community believes in this vision.
Yeah.
And they believe in the grit and determination and resilience and working together and collaborating, that it feels to me like there's hope here.
And it's spreading.
It is.
It's spreading. You talk about sparks. I think of taking a spark and passing it. Light your fire, light your fire, light your fire, light your fire. And that's what's happening. We're already seeing it. We're hearing it. And it's such a,
I've said this to a lot of our folks internally who have at times felt overwhelmed with the unknown, with the lack of predictability, the chaos, the not knowing we're going to open. Fear.
Yeah.
And I've said, has there been one thing over the last 2 years that would suggest that we're not doing exactly what we're supposed to be doing?
Yeah.
The answer is no. There's not been one interaction. There's not been one meeting. There's not been one stakeholder There's not been, right? Like I could go down the list, but there's not been one moment where the universe or any of the people in it have said, you're not on track. You're not aligned.
Right.
That brings to me the confidence as we continue to bring more people into this vision, more people get hired, more people walk in the door, and you see the fire in their eyes. Day one.
It's dope.
Because they're just like, I'm going to be a part of this thing.
Yeah.
That's what continues to light me up inside, where I continue to feel so on fire, even amongst
all the chaos and craziness.
the pressure of a startup, and we're burning money and all of these things. It continues to say there's been not one moment in 2 years that has suggested we are not completely aligned with this community, with the community members, with the employees, with the vision. It says we are doing exactly what we're supposed to be doing. That brings me a lot of comfort every single day.
Yeah, I mean, it's the most I've been fired up working in this industry. Like literally when I first started working in this industry, I was on fire. Young, naive, dumb, thought I knew everything, but was on fire. And I remember a couple of years in thinking, oh man, I'll never feel that way again. Alas, here we are. I feel more on fire now than ever.
Me too.
And it's pretty remarkable.
I imagine this will just be the beginning of us continuing to share the journey of Ava Health and where we are. And it's November 2020, Ava Health, and it's real. And, continuing to be curious and just move forward day by day, one foot in front of the other.
The story is still being written.
Oh, yeah.
So
every day we're at the plate. We're about to take a swing. That's right. In a world where there's hard truths,
real conversations,
and sparks of possibility.
From a world that's a little
broken-ish. Love you, Rum.
Love you, dude.
See you next week.
Can't wait.
Like, comment, subscribe.
Peace.